Hi guys, Melanie here with Yoga and Mobility with Mel. We're going to talk about alignment and posture. This is important all of the time. However, when you become pregnant, the weight grows out to the front. And for a lot of women, they can get this excessive curve in their lower back and a lot of lower back pain because of this dumping of the pelvis forward. So we're going to talk about how to properly align your body so that you can access a better core breath as well. Okay. The other thing to note as well is that as you become more heavily pregnant, almost 100% of women will get a diastasis recti. We'll talk about that in another video, but it's where your rectus abdominis, you have your right and your left side, will move away from your linea alba. So you have this linea alba line which connects from your pubic bone all the way up here into your rib cage xiphoid process. And so the tissue expands and moves open. So if your posture is pushing out a lot, you're going to pull even more on that line, which is another thing that we want to minimize as the belly grows and swells a bit more. Okay, so let's talk about what we're looking for and what we're not looking for in our posture. The first things you want to pay attention to are our feet. We want our feet to be hip-width distance apart. So the way to check that is you find those two bony bits, and then basically putting the heel of your hand onto that, pointing your fingers down. You want your fingers to dissect through your knees and down through your toes. Okay, so that the toes are pointing forward. We want to be aware our toes aren't pointing out, pointing in too far, but they're just nicely lined up. Think like rails on a train track. Okay, so from there, finding that nice positioning of the feet, then we want to pay attention to where our pelvis is in space and where our rib cage is in space. So we have our thoracic cavity here and our pelvic cavity here. And we want them to line up so they're stacked on top of one another. I'm just going to turn to the side. So, what can happen when the belly grows and more weight comes out into the front? For a lot of women, they may push forward, and then maybe the shoulders are back, their butt, their hips are pushing forward, and then we get this excessive curve in the lower back, which can translate to a lot of lower back pain for women, which is common to have this pain in their lower back. And that can oftentimes be because their pelvis is shifted forward and maybe their shoulders are rolling back. Another thing that can happen here is that the shoulders can round down. Sometimes through pregnancy you gain a bit of weight, but the breasts can get a little bit bigger too, so this rounding of the shoulders can come here. So it can either be kind of like this or a little bit up here like this. Okay, so that we want to back our pelvis up over our hips. But as we back our pelvis up over our hips, we also want to pay attention to where the ribs are, because what can happen is that people pull their pelvis back, but then they arch, then they do kind of a J-lo butt, but then their ribs are poking out here. And then with the rib cage flailing forward, it's also pulling on this linea alba line, which we want to maintain a little bit nice tension. So we want to lessen the tension on that linea alba. So we want our rib cage to be down. Okay? So this means backing our pelvis up, paying attention to where the ribs are, not letting the ribs flare up, but pulling the ribs down. A lot of people can feel like their shoulders then are rounding forward when they bring the ribs down. So keeping the ribs down, but just kind of slightly rolling your shoulders back. Now you want to pay attention as well to your butt and your glutes, because a lot of times women can then squeeze and then just like grip really tight into their glutes all the time, which is also not what we're looking for. You want to rather think about your butt cheeks blooming like a flower. Okay, so we're not gripping into the glutes. Legs are active, but the butt, the glutes are released. So you're releasing some tension as well into the back of your pelvic floor also. So is pulled back, rib cage is lined up over the pelvis, shoulders are back slightly, so we're finding this nice plumb line. So you can use a mirror to look at yourself or take a picture to see where you naturally stand. You want your body weight a little bit more back into your heels, maybe 60-40, 60% in your heels, 40% in your toes. Then from there, knees stacked over your heels, hips over the knees, shoulders over the hips, and then your ear back over your shoulders. So you find this nice plumb line. You could also, in addition to using a mirror to test this out, you could grab a piece of string and then you hold it from probably under your armpit here and then let it hang straight down, and it should just nicely intersect through each of the major joints as you hold it here. Okay, so that's a little information on our alignment and posture that we want to be aware of all the time, but especially as you become pregnant and the belly pushes out more forward. We want to keep that belly pulled back, hips back, and our ribs down. So we're maintaining this nice stacking of our pelvis over our rib cage over our pelvis, and then that's going to help you to be able to access a lot better core breath, which we'll talk about in one of the next videos.